Where did COVID-19 come from? It's a question the world's been asking for 3 years now. The debate around it was ignited this past week after the United States Energy Department concluded that a lab leak in Wuhan, China was the most likely source. But there remains a divide both within the intelligence community and among scientists over the true origins of the pandemic. Will we ever know the real answer? Joining me now is Dr. Lena Wen, a professor at the George Washington University School of Public Health and the author of Lifelines, A Doctor's Journey in the Fight for Public Health. Welcome, Lena. I want to first ask you, what do you make of this assessment from the Department of Energy? Is it a big change?
Well, frankly, Fareed, I don't know what to make of this assessment because we don't know what exactly the Department of Energy found. According to CNN reporting, it seems like they're saying there is a lab in Wuhan, the Chinese CDC in Wuhan, that was conducting research into coronaviruses. Well, we already knew this, and what we're missing now is a link between the samples that were being studied and the individuals who may have gotten infected because of it, and whether that in fact is COVID-19. And the Department of Energy assessment was made with low confidence, and there are 4 other intelligence agencies within the U.S. that came up with a different assessment, thinking that the zoonotic origin, the animal to human spillover, is more likely. And so I think at this point there is circumstantial evidence on both sides, but there is one thing that the intelligence community has found, and in fact has been really unanimously saying since early on, which is that this was not intentional. This was not a bioweapon. This was not something that China or scientists or whatever politicians or political leaders were trying to do.
Yeah, that's so well put, because it struck me. I mean, I was also one of those people who were initially confronted with the evidence, what little we had, said, look, it appears that a lot of these diseases that we've been seeing, SARS, MERS, avian flu, Ebola, seem to have zoonotic origins. I think that there's some question about SARS, but most of the cases, these seem to be animal to human transmissions out in the wild. And so it seemed plausible that this one also came this way. But in either event, you're saying it's absolutely clear it was accidental.
That's right. I mean, that's what the intelligence communities have found. That's also what virologists, scientists have found as well. And so we're looking at 2 possibilities. One is that there was some kind of lab mishap. And that's possible because lab mishaps have happened before. It's happened here in the US where, for example, in 2014, federal health officials found that there were unlabeled vials in an unsecured storage area that turned out to be smallpox. The CDC, in fact, has made mistakes when it comes to the anthrax bacterium or a pandemic influenza. And so we've had lab mishaps. Just last year in the Netherlands, there was also a lab mishap involving polio, and a lab worker accidentally got infected with polio there. And so this is something that certainly can happen. But at the same time, you're right, Fareed, that 3 out of 4 new or emerging diseases come from zoonotic origins. And so we also need to look at the effect of climate change, deforestation, these wildlife wet markets, and what the contribution there is. And so I guess my point here is that we need to shift the question. We may never definitively know the answer of what exactly caused COVID-19. And so if we think that there are these 2 possibilities, both of which are likely, then why are we not working to prevent both of these things from happening in the future?
One of the reasons we'll never know this is that the Chinese government is really not cooperating and is, if anything, feeding a certain amount of false information or incomplete information. And that, there's the question that people have, which is, should there be accountability for the fact that the Chinese government really has not been very forthcoming from day one, from the origins of the virus, and that may have contributed to its faster spread. What do you say about that?
I'd say that it's a really complicated issue because on the one hand, of course, you're totally right that the obfuscation on the part of the Chinese Communist Party has been totally unacceptable. I mean, the Chinese government didn't allow a WHO, World Health Organization expert team to enter the country. We're now more than 3 years into the beginning of COVID. It's like trying to investigate a murder after 3 years and the initial evidence may be gone. And so what they did then, and also the lack of containment initially, was really wrong. But at the same time, if we're threatening sanctions and reparations and even criminal liability, as some politicians in the US have suggested, that's not going to make China cooperate more. We don't want to worsen the prospect of global collaboration, which is honestly what we really need to tackle future pandemics too.
And so your fundamental point in the Washington Post piece, which I really thought was terrific, is that we need to understand that the real reason we're seeing the rise of so many of these kinds of viruses over the last 30, 40 years, really starting with AIDS, is that human beings are living in ways that are more dangerous. We're living closer and closer to wildlife. This urbanization is making that happen. Climate change is exacerbating it. One of the things I worry a lot about is factory farming, where you have, tens and tens of thousands of chickens and pigs, in fairly unsanitary conditions. And that's what makes the next pandemic quite likely. Have we learned any lesson from COVID?
I think we've learned some lessons. As to whether we've implemented these into practice is less clear to me. We definitely have recognized the importance of surveillance, and I think we're seeing more early surveillance, including using wastewater. I think that's a very good thing. We've also seen the impact of global collaboration and how we, as the world of scientists, have come together to, for example, create these vaccines and deliver on treatments in record time. I think those are all very positive things. But what I really worry about is that public trust is really eroded in public health. And that is everything. And I really worry that in the discussion about the origin of COVID, that people have hitched onto various theories as part of their political identity, which is really not how science is supposed to work.
Lina Wen, pleasure to talk to you.
Thank you, Fareed.
Thanks to all of you for being part of my program this week. I will see you next week.